Center. So today I'll be talking about mindful eating and overcoming eating disorders. First of all, I don't have any grant. I'm just paid by Sengkang General Hospital, so there's no conflict of interest here. Yeah, so the Brahm Center don't pay me. Yeah. So today we'll be talking about what is normal eating, what are eating disorders, what are the symptoms of eating disorders, and how has mindfulness progressed as a form of treatment for eating disorders. Yeah. So for those, so let's have an introduction first. So very often we talk about being fat, right? And when we are having lunch, sometimes you'll go like, oh, I don't want to eat this. If I eat this, I'm going to put on weight. Do you all do that during lunches now? No. Okay, so some of you did, right? Don't eat the dessert, don't eat the fried food. Yeah, so fat talk is actually very prevalent in this day and age. Yeah. And many of us here are probably a bit unhappy with your body, right? Is there anybody who is 100% happy with the way you look or 100% happy with your body? Yeah, even for me, I have to stand on a thing, right? I'm not that tall. Yeah. So, but actually, I'm quite happy to be short. Yeah. Yeah, but I don't mind being a bit slimmer or a bit more muscular. So that's my eating disorder voice talking. Or when we go to a buffet, we eat a lot, right? Nobody will go to a buffet and don't eat, isn't it? Yeah? You won't go to a buffet and attack the salads, right? Yeah. And then another thing is sometimes we also skip a meal occasionally. Like, we ate a lot for dinner, then the next morning when your mom prepare breakfast for you, you say, don't want. Or you scoop the butter away. So is this abnormal? Do you think it's abnormal or it's normal? Yes, actually it's normal. So this is what we call normative discontent. If you are a bit unhappy with your body, actually it's normal. You want to lose a bit of weight, you want to gain a bit of muscle, it's normal. But what is abnormal? Now, this is, of course, the poster girl for eating disorder. For those who are old enough, you all will recognize her, right? Karen Carpenter, right? Yeah. So this was her before she had eating disorder, right? And then you can see as the years and the months go by, she started shrinking, and in the end, she actually died from anorexia nervosa. I think a lot of us would. If you have the time, you go to Spotify, you listen to her songs, she really sounds very good, even by today's standards. So it's really, and that time don't have all those auto-tuning, right? So it's really a pity that she couldn't be saved. Yeah. Even today's pop star like Zayn Malik, he also confessed that he has some eating disorder, right? He said he'll go for days, sometimes 2 or 3 days without eating anything at all. Do you all know who he is? The younger ones would, right? Yeah. Yeah, I'm very inclusive, so cover all the spectrum. So, do you all know who she is? Anybody know who she is? Huh? Portia, yes. Those that watch Ellen, right? This is Portia de Rossi. She was in Ally McBeal. Yeah, so she wrote a book called The Unbearable Lightness, and she said, I didn't eat for 10 days before. And this one, do you all know who she is? Demi Lovato, right? I heard that. Wow, someone reads a lot 8 days here. So, yeah. So she said, I'll be lying if I said there weren't days where I just want to stay in bed all day because I'm ashamed of my body. So when it comes to eating disorder, the 3 most common ones are this: anorexia nervosa, bulimia nervosa, and binge eating disorder. Actually, they are really along the same spectrum. They are really pretty much the same. The main difference is in their weight. So if their underweight is anorexia, if their normal weight is bulimia, normal to overweight is binge eating disorder. So a lot of times I ask my medical students, do you know the difference between anorexia and bulimia nervosa? They'll say, one will purge, vomit, and the other doesn't. Actually, it's not correct. Even the underweight one can vomit or can don't vomit. Yeah. So the main difference between the 3 is really in the BMI. But in binge eating disorder, they are more likely to be overweight because they do not do anything to counter the binge eating. They don't have any compensatory mechanism. That means after eating, they don't exercise more, they don't try and skip a meal, etc. That's why their weight will go up. So these are common for all the eating disorder. There's a lot of fear of weight gain. Actually, you all know eating disorder in Chinese is called, you know what it's called? 厌食症, right? You know, 厌食症. Actually, it's a misnomer, I always feel, because they don't really hate food. Actually, they still love food and they think about food a lot. So it's not really 厌食. 厌食 means dislike food. Yeah, actually, they don't dislike food. Yeah, what is really very prevalent is this very fear of weight gain. Like even gaining, I have a patient, she gained 500 grams and she overdosed. Yeah. So even a little bit of weight is very scary for them. And their shape and weight strongly influence the way they feel about themselves. How good they feel about themselves is very strongly affected by their shape and weight. There's a lot of abnormal eating. Normal eating, like a lot of food rules, avoiding certain food types. After certain hours they cannot eat, or if they eat this, they must do that. So there's a lot of abnormal eating, and there are inappropriate ways of losing weight, not in binge eating disorder. So in binge eating disorder, right, there is recurrent episodes of binge eating. They have a lot of distress when they binge eat. It happens at least 1 time per week for 3 months, and like I mentioned just now, there's no inappropriate compensatory behavior. Now, I'm highlighting binge eating disorder because it has more evidence when it comes to treatment using mindfulness compared to the other two. So just now we talked about buffet, right? When you go to a buffet, are we binge eating? How many people think we are binge eating? Yes. Okay, so binge eating means there must be 2 elements, The first element is there must be a sense of loss of control. So it's not just an inappropriate amount. You must also feel like a sense of loss of control. And after eating, there's a lot of guilt. There's a lot of unhappy feelings, a lot of disgust. Does this happen during buffet? No, right? Actually, there's a lot of control, isn't it? Yeah. You don't go for the salad or the bread, right? Even if you like bread, right? You go for the oysters, the lobsters, whatever you feel will cause the restaurant to go bankrupt, right? Yeah, so actually there's a lot of control. And then even when you're very full, you still force yourself to eat some more, right? Even when it's very, you just want to get your money worth. And after that, you feel a sense of triumph, isn't it? You feel very happy. You tell your friends how much you ate. You say, hey, I eat more than you. Yeah? So that's not binge eating. That could be overeating. But binge eating is not like that. Yeah. In binge eating, they typically eat things that they do not allow themselves to eat, like bread, like rice. So they'll eat like 1 whole loaf of bread. Biscuits, we're talking about 10, 20 biscuits. 3 packets of instant noodles, things that you would never eat in buffet. So these are the kind of stuff that they eat because they don't allow them to eat all these things. If you don't believe me, today you tell yourself, I cannot allow myself to eat ice cream. Don't allow yourself to eat ice cream. When you go to Orchard Road, you hear the guy ringing the ice cream thing. You will feel the urge to eat ice cream, even if you never like to eat ice cream. Just by telling yourself you cannot do it, when you hear it, when you see it, you want to do it. Yeah. So this is like what I've explained just now. Now, eating disorders are associated. Binge eating disorders are associated with obesity, with depression, with anxiety disorders, personality disorders, substance use disorders like alcohol use. And for a person who is obese and have binge eating disorder, when they go for surgery to staple their stomach or cut off their stomach, actually the outcome is not so good. Because even when the stomach is very small, they can still drink very high caloric drinks as a way of binge eating. So I have a patient, she will blend the food, blend it and drink it. Yeah, even though she had the operation already, she wanted to binge, but she couldn't, you see. Yeah, so she would blend it into a drink. Now, why do eating disorder happen? Actually, it is not. It is often people misunderstand mental illness as like a weakness in personality, or they are just weak or not resilient. Actually, this cannot be any further from the truth. Now, mental illness is often due to a combination of personal factors like psychological factors, our genes, and of course the social environment as well. This is pretty much the same in all kinds of medical illness, like in diabetes, right? Diabetes is also a combination of all these factors. It's not just because they are greedy or they don't exercise, right? Many people with diabetes, they have parents with diabetes as well.